basically the two important sessions. Can you all hear me?
Yes.
Okay, so the two important topics will be the histology and the anatomy of breast. Okay, the SLP topic. So what you need to know is in histology, as far as OSPE is concerned, like if you are talking about OSPE, we need to, or should we wait for a few more minutes? Maybe 2 more minutes, huh? We'll wait and then maybe, or you just let them know, nah? Okay, so for OSPE, basically there are only two things. In kidney slide will be kidney section of kidney will be given, and you guys need to identify the either the renal corpuscle, the glomerulus, or the Bowman's capsule, the lining epithelium, proximal and distal convoluted tubule, and sometimes the macula densa. Those things you need to identify. And proximal and distal convoluted tubule, always remember how to differentiate between them, like a few points which enables you to differentiate between those two structures. Yeah, and then maybe then sometimes collecting duct will also be asked. Sometimes if a smaller magnification is given, then we may ask you about the cortex, medulla, to differentiate between cortex and medulla. These are the most important points which you need to remember regarding the histology of urinary system. Okay, ureter, urinary bladder, almost the points are almost going to be the same. So just in case in any of these things are given, like you can write the common points also. It should be almost the same. The lining epithelium, transitional epithelium. Then you'll talk about the muscle layer and also the final the adventitial layer. Okay, so next, what else? The embryology topic, right? So embryology. Um, Basically, in embryology topic, all you need to know is about the embryological abnormalities which I've given in the notes. Like nothing other than the notes will be asked. But only thing is what you need to know is when an embryological abnormality is given, you need to answer what kind of deformity can lead to that. Okay, so maybe the embryological defect may be of kidney development, or maybe about the ureter development. So the scenario will be about any embryological abnormality, and the MCQ answers will be like what can be the cause for this. So then maybe we talk about either the mesonephric duct or the ureteric bud or ureteric duct, like whatever the area is concerned, the question will be based on that. Okay, so ideally you should know what normal structures, like the embryological structures contributing to the adult, like in a normal human being, what are the embryological structures giving rise to the adult structures? Like say, for example, urinary bladder, like what are the embryological structure giving rise to? That is one set of things you need to know. Like say ureteric bud is giving rise to ureter, or like the collecting system, excretory system, how they are formed, like what is metanephros, like so metanephros will give rise to the definitive secretory component, something like that. Like you should know what are the embryological structures giving rise to the structures in the baby. Okay, that is one thing. Second thing, you should be able to correlate clinical scenarios, like say for example some of the conditions. Okay, all these are important, especially for your MCQ and EMQ in all your topics. Like sometimes because these things are not being asked in either OSPE, or sometimes rarely they are asked in MEQs. Okay, so as a result, to cover all the areas, sometimes these type of questions are almost asked in all the EMQs, not just for this module, like all the other modules also. So just don't leave these topics just like that before you go for exams. Maybe this or later the first row as well. Just go through them in the end, like at least you have a table kind of thing. Okay, what is the structure, this thing giving rise to what? What happens if it is not properly developed? What is the embryological deformity that can happen? So you have a table kind of thing for you to revise, so that will be easy for you, okay, as a last minute revision. Is there anything else you want to ask in this before we move on to the breast topic? Okay, in a histology topic, I forgot. Like as I told you, that is for OSPE. You need to identify them. As far as this theory component, sometimes the questions can be asked in MEQ. Okay, so in MEQ, if at all being asked, as I've said earlier, you should be able to differentiate between proximal and distal convoluted tubule, like and say collecting duct as well. All these three ducts. Okay, if there is something question on tubules or anything, we will be asking you like, okay, the physician observed this, something like that under microscope. I can give you a leading statement and I can ask you about how to differentiate between these two tubules and PCT and DCT, and as well as collecting duct as well. So you should know location. What about the lumen? What about the epithelium? Okay, is there any like a surface modification like microvilli? All these changes you can mention and you can talk about the differences. That is one thing. And next we will also ask you about the glomerular this thing, like what is that, the renal corpuscle. If there is anything on glomerular disease or something, we can ask you this question as well. Okay, so the question about renal corpuscle, about the contents and all those things, and you can also learn more about all the filtration, what are the layers, and then you can also read about the um, differences. I've told you this, I've told you. And then ureter, urinary bladder, maybe if at all a question is on sometimes urinary bladder, any carcinoma, something, if the scenario comes up, you will be given a question. Sometimes the urinary bladder histology can be asked as well. Okay, so moving on to the next final topic, anatomy of breast. This I'm not sure. Maybe like the most common one what we can get is um, all the clinical this thing, whatever I've told you, it is important for you to know. Okay, clinical findings and why they happen. Those things are very important. You understood? So all the clinical aspects what I've given later part you should know, and basically in the introduction part all the location is important. Where is it located, from 2 to 6 strips, and from horizontally from where to where, what is axillary tail of Spence, you should know. And then later especially this lymphatic drainage of breast, it's very important. Okay, similarly in GIT, I've told you repeatedly many times, but in the stomach, okay, for stomach also, whenever you read those topics, stomach lymphatic drainage and breast lymphatic drainage, these things are very important. Okay, and because these about when we ask about carcinoma, generally from anatomy, the question can be on the lymphatic drainage. Okay, and about the lymphatic drainage is important. Previously, the anatomy, this, and then the structural components also. Like what is parenchyma, what are the supportive tissue you can get over there, just an idea, like at least you, the language is also simple. I think you should be able to read the whole slides. Okay, it's important for you for now as well as in your clinical years surgery, it will be helpful. Okay, so please read that topic properly. I think you should be good enough. Okay, should be done. Anything else in this? Any other doubt, anything you have to ask?
No.
Okay, is that all? Then I think that those are the three topics, right? from my side?
Yes.
Okay, then that's all. Like embryology, as such, in other modules now, embryology just look for EMQs and MCQs. Not saying that's not important, but if you want good marks, then you should be reading that as well. Okay. Other than that, these two are either in OSPI or sometimes in MEQs. You will get them. Okay, guys. All the best. Read well. Then we'll see you later. Then. Okay.
Thank you, Doctor.
Thank you, Doctor.
Thank you, guys. Thank
Thank you,
you.
Doctor.
Thank you, Doctor.
Thank you. Thank you, guys.